Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it. So in order to understand ABO incompatibility, let's start with a little bit of a review of blood types. When we think about different blood types, we're thinking about the antigen that is on the red blood cell. So for the A blood type, we have an A antigen on the red blood cell. If the A antigen's on the red blood cell and there are no Rh factor on the red blood cell, they are A negative. If they have the A antigen and they have the Rh factor D protein, they are A positive. For the B blood type, we have B antigens on the red blood cell. If they do not have the Rh factor, then they are B negative. And if they do have the Rh factor, they are B positive. For AB blood type, we have A antigens and B antigens on the red blood cell. If they have the A antigens and the B antigens and they do not have the Rhd protein, they are AB negative. If they have the A antigen, the B antigen, and the Rh factor, they are AB positive. If the red blood cell does not contain either the A antigen or the B antigen, they are O. If they do not have the Rh factor, they are O negative. If they have no A antigens and no B antigens, but they have the Rh factor, they are O positive. So what does that mean for our ABO incompatibility? With ABO incompatibility, the mother is O. She is either O negative or she's O positive. So she may or may not have the Rh factor, but she does not have an A antigen or a B antigen. In order for this to be an issue, the baby needs to have the A or the B antigen. So the baby could be A negative, the baby could be A positive, the baby could be B negative, the baby could be B positive, the baby could be AB negative, or the baby could be AB positive. Any of these scenarios has the baby having either an A or B antigen or both. And the mom does not have either of these antigens. So with this incompatibility, if the mother is already sensitized and has antibodies from some other reason, they can attack this current pregnancy. Okay, so if mom is blood type O, whether Rh positive or negative, and she doesn't have A or B antigens, and the baby has them, it's recognized as foreign. With this incompatibility, the mother's body already has antibodies potentially to these other blood types, and so the antibodies can attack the red blood cell of the baby with this current pregnancy. This is not something that can be resolved with RhoGAM. Okay, on a previous video with Rh incompatibility, we discussed the use of RhoGAM with Rh incompatibility, but that does not work with ABO. So if the mom's blood has antibodies circulating, then they can attack the baby's red blood cells. And if they attack the baby's red blood cells because they see this, like if the little purple pieces are A or B antigens and these are the antibodies attacking it, they see it as foreign. If this happens, it breaks down the red blood cells and it puts the baby at risk of hyperbilirubinemia because the bilirubin is released with the breakdown of red blood cells. This is not typically as significant as the Rh incompatibility in the severe anemia and the things that can cause, but this definitely can be a setup for jaundice for the baby. So how we can test for this, a direct or an indirect Coombs test. The Coombs test looks for antibodies. In an indirect Coombs test, we're looking for antibodies in the mom's bloodstream. So if we go back to the previous slide, that's this first picture. okay? The second picture, this would be a direct Coombs, where we are actually seeing antibodies from the mom on the baby's red blood cells, okay? If the Coombs test is positive, it increases our risk of hyperbilirubinemia in the baby because the antibodies are going to break down the baby's red blood cells and release the bilirubin. The Coombs test can be used to detect antibodies actually for both Rh and ABO incompatibility, and we also call this the direct antiglobulin test or the DAT test. So let's practice. A mother with O positive blood type whose husband's blood type is A negative has just given birth. The major sign of ABO blood incompatibility in the neonate is which complication or test result? A negative direct antiglobulin or globulin test, jaundice, cephalohematoma, or a positive indirect Coombs test. So for this question, the mom is O positive and the husband is A negative. Does the Rh matter? The Rh does not matter for ABO. Okay, so now we're looking at the choices. It wants to know which either test or complication is going to be a major sign of the ABO incompatibility. So a negative direct antiglobulin test. So that test or direct antiglobulin test is positive if the antibodies are found on the baby's red blood cells. So this is not correct. Jaundice. We know that if the antibodies are on the baby's red blood cells and they're breaking down the red blood cells, it's releasing bilirubin, which can cause jaundice. So that is potentially correct answer. Cephalohematoma. A cephalohematoma is a collection of blood that can happen in the baby's head. This is not related to ABO incompatibility. Positive indirect Coombs test. Remember that with the Coombs test, the indirect Coombs is finding antibodies in the mother's blood. Direct Coombs test is if it finds the antibodies on the baby's red blood cells. So of these choices, the major sign of ABO blood incompatibility in the neonate, the answer would be B, jaundice. Next question, true or false? ABO incompatibility only occurs if the mother's blood type is O and the baby's blood type is A, B, or AB. Is that true or is that false? This answer is true. The mother's blood type is O and the baby's blood type is anything else. Anything AB or AB that can be seen as foreign. A nurse in the newborn nursery is monitoring an infant for jaundice related to ABO incompatibility. What blood type does the mother usually have to cause this incompatibility? A, B, AB, or O? So this is asking the mother's blood type, not the baby's blood type. So the mother's blood type would be O. And finally, which condition is most likely when the mother's blood type is O and the baby's blood type is AB or AB? Erythroblastosis fetalis, Rh incompatibility, vitamin K deficiency bleeding, or ABO incompatibility. So remember that erythroblastosis fetalis is a very severe condition that often is going to be more prevalent with an Rh incompatibility when the red blood cells are being broken down by mom's antibodies at a very high rate, not as common with ABO. Rh incompatibility is the B answer. That is when we have an incompatibility if mom's Rh is negative and baby's Rh is positive. Vitamin K deficiency bleeding is not related to this at all. And then ABO incompatibility is the best answer. Mom's blood type is O, baby's blood type is A, B, or AB. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.